This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about when to get trigger finger surgery. So if you're watching this video, maybe you have trigger finger, or maybe you just kind of have pain in your hand. And what trigger finger is all the flexor tendons of your hand, they go through this pulley system. And there's a pulley right here we call it the A1 pulley, where sometimes the tendon gets stuck. And it'll kind of cause pain, and then if it really gets stuck, the tendon can't slide well, and you'll kind of get a triggering motion where the finger kind of springs open. And you see it more common in diabetics. People who get it in one finger are usually likely to get in other fingers. So the question is, when should you do surgery for this? Well, I would say that if you haven't sought any treatment for your trigger finger, the first thing you want to do is get a steroid injection, because that can actually be curative in 70% of cases. Steroid injections in other areas of the body, like let's say the knee joint, like that's just a band-aid if it's arthritic, where it's not really curing anything. But there's other areas of the body, and trigger finger is one of them, where a steroid injection will actually cure the trigger finger. So I would definitely try at least one. You can get a couple, but if you're getting to the point, and there's also stretches you can do. It's mostly this stretch here where you kind of just get the tendon riding through, and that should usually help with your pain and movement. Along with the steroid injection. If you've tried those things and they're not working, and you've had a couple injections and it's just not getting better, then you may want to think about the surgery. What you don't want to do is just be stuck with a stuck finger for forever and leave it in a position like this, because what can happen is over time, if you don't move it, it'll really get stiff, and not just from the trigger finger, from the rest of the finger will contract. That's very rare. I don't really see that too often. Most people get it taken care of beforehand. But yeah, if the injections haven't worked, and the stretching doesn't work, then it'll be time to consider surgery. And as far as orthopedic surgeries are concerned, it's a relatively basic one. I mean, you're talking 10 minutes in and out, outpatient surgery, and it usually will take you down for a couple weeks, but not terribly long. And the surgery is basically the doctor will go and make an incision here, or depending on the finger, and will cut that pulley. And that's okay, because you still have other pulleys that hold the tendon in place. And that's basically the surgery. So again, if you've got injections and therapy and it hasn't really been working, and you still have pain and stiffness of your finger, you may want to consider trigger finger surgery. I hope I was able to answer your questions about when to get trigger finger surgery. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. If you like this video, we put out new content every Friday, so please like and subscribe. And thanks for watching.